Namaskar. Today we will study difference between type 1 and type 2 diabetes mellitus. So diabetes mellitus is a chronic metabolic disorder characterized by hyperglycemia. So there is increased blood sugar level more than normal, and the main characteristic feature is hyperglycemia, and this hyperglycemia occurs because glucose is not entering into the cells. Glucose is the source which is converted to ATP to provide us the energy through the process of glycolysis and Krebs cycle. And the hormone which penetrates glucose into the cell is insulin. So in absence of insulin, glucose cannot enter into the cell, so glucose remains in the blood, and that condition is called hyperglycemia. So based on this insulin deficiency, whether the deficiency is in absolute deficiency or it is relative deficiency, we can have two types of diabetes mellitus: type 1 diabetes mellitus and type 2 diabetes mellitus. So type 1 diabetes mellitus is called as insulin dependent diabetes mellitus, and type 2 diabetes mellitus is called non-insulin dependent diabetes mellitus. Why it is called insulin dependent? Because there is absolute deficiency of insulin and we have to administer insulin to treat these patients. So it is insulin dependent. In these patients there is relative deficiency of insulin. Insulin is there, may not be sufficient, but insulin is there and we don't need insulin to administer to these patients. We only need to release that insulin if insulin is deficient, insulin deficiency is there, or if there is insulin available but insulin resistance is there, then we need to give drugs which can increase the sensitivity of insulin in case of insulin resistance. That's why it is called non-insulin dependent. Does not depend on insulin to treat these patients. So insulin dependent because insulin is needed to treat these patients. Non-insulin dependent because insulin is not needed to treat these patients. And this is called type 1 is also known as juvenile onset diabetes mellitus because the patients are usually young. The young children up to 20 years age, it starts, whereas when the patients are old, the type 2 diabetes mellitus occurs mostly after the age of 40. Nowadays, however, young people with 30-35 years age also suffering from type 2 diabetes mellitus. That's why we call it as maturity onset diabetes mellitus. This is juvenile onset because it occurs at a young age, and type 2 is called maturity onset because it occurs at old age. And type 2 diabetes mellitus patients are usually obese, whereas type 1 diabetes mellitus patients are not obese. Then the beta cells are destroyed, and we can call type 1 diabetes mellitus as an autoimmune disorder where antibodies are found, antibodies against the beta cells of islet of Langerhans of pancreas are found. So there is destruction of the beta cells, so the pancreas loses the ability to secrete insulin, so there is absolute deficiency of insulin. But in type 2, either there may be relative deficiency or there may be more insulin because of insulin resistance. That means insulin is there but insulin is not able to function, not able to work. That is called insulin resistance. So either there may be relative deficiency, that means beta cells are there but beta cells are not producing sufficient insulin, or there may be insulin but insulin is not able to do its function, so there is insulin resistance. So these two may be the cause of type 2 diabetes mellitus: relative deficiency of insulin or insulin resistance. So both the causes can be also there. So the beta cells are intact, no beta cell antibodies are found, and the beta cells are dysfunctional or non-functional. So if we see the secretion of insulin in response to any secretagogues like glucose or amino acid or fatty acid, then two phases are there. Phase 1 where the stored insulin is secreted, so that is immediate phase, and it is released in high quantity, followed by phase 2 which is the delayed phase and released in small quantity. So that is normal response, two phases, phase 1 and phase 2. So there are two phases of insulin secretion. But in type 1 or insulin dependent diabetes mellitus, since there is no beta cells, so there will be no release of either stored insulin or the synthesized insulin. So both the phases are absent. This is the graph for type 1 diabetes mellitus. But for type 2 diabetes mellitus, the first phase is absent. There is no stored insulin, only synthesized insulin is available. So the phase 2 is present, but phase 1 is absent in case of type 2 diabetes mellitus. So in response to any stimuli, glucose or amino acid or fatty acid, any stimuli, there will be no response in case of type 1, whereas response to any non-glucose secretagogues is normal. That is amino acid, the sulfonylureas, glucagon, the gastrointestinal hormones like incretins. So for them, this is normal. So response to non-glucose secretagogues is normal. Type 1 diabetes mellitus is less common and type 2 diabetes mellitus is more common. So most of the people suffer from type 2 diabetes mellitus. And if you see, the type 1 diabetes mellitus has a low degree of genetic predisposition, whereas type 2 diabetes mellitus has a high degree of genetic predisposition. And in type 1 there is hyperglycemia, proteolysis, lipolysis, ketosis. So it involves the disorder in metabolism of carbohydrates, proteins and fats, whereas in type 2 diabetes mellitus mostly it is a disorder of carbohydrate metabolism and there is hyperglycemia. And type 1 diabetes mellitus, as we already discussed, can be treated by insulin only. Insulin is required. Insulin replacement is the mode of therapy. Whereas we can manage the type 2 diabetes mellitus through diet and exercise, and if diet and exercise are not enough, then we can use the oral hypoglycemic agents, and if even oral hypoglycemic agents are not enough, then we can add insulin also. So this is all about the difference between type 1 and type 2 diabetes mellitus. Thank you.